So I'm going to go ahead and get started with the meat of the program for tonight. This is what we're going to be talking about. I'm going to go ahead and just kind of throw everything out there, and then we're going to go through and break down piece by piece. We're going to be talking about Volux, which is probably my number one favorite thing that has happened in this place in a few years. It is jawline rejuvenation. It helps mid and lower face restoration. We're going to get into that in a few minutes. We're also going to be talking about HydraNeedle, and our HydraNeedle has there's two types of HydraNeedle, the esthetician HydraNeedle and the medical grade HydraNeedle. I'm going to talk to you about our Vivacé updated protocols that we're all excited about here. We're going to talk with you about some of the new products that are coming out that are working so well. Our Deka CO2 laser, which is a little bit more intense laser than we've been offering in the past. And we've also put together 12 specials, actually, 12 wow specials. So we're going to carry on. First of all, here is our new baby. Mary and I are so excited about this. This is Juvederm Volux. And if you remember, we have had several of the Allergan products that we use over time. Started out with Juvederm Ultra, which we typically use in the lip area, nasolabial folds, things like that. Juvederm Ultra Plus is another. It's a little bit thicker. Somebody that wants a fuller lip, a more hydrated, bigger lip, we will use something like Juvederm Plus. There's Volbella that we like to use under the eyes or in the lips if you're just looking for hydration, no structure in the lips. There's Velour that we've used in the lower face. There's Voluma, which many of you are familiar with. So Juvederm Voluma to this day has been the best thing that we've had for building cheeks, lifting the cheek up, and for lifting the jawline. And it was really good. But it wasn't great at holding back the jawline because that's heavy tissue. And there's a lot of things that happen over time in the jawline that we need something a little bit stronger. So we have been watching Juvederm Volux in Europe for several years, and we've been so excited with what we've been seeing. But of course, we had to wait on FDA to give us the approval on our Volux. So you may say, well, what matters about a jawline? Why is this such a big deal? When we're talking about jawlines, there's probably 3 different times when we're really going to lean on something like our Juvederm Volux to help give us some lift. So first of all, if you just have a genetically short jawline, and you know what I'm talking about, somebody whose nose is advanced a little bit more than their chin. So it looks like they have a short chin and a weaker jawline. We can actually work with Volux to create a more defined jawline and lengthened chin. And second of all, as we age, we start to really lose some of the bone in our gonial angle back here. And so that loss of bone allows this jowl to lean forward and get just a little fuller there. And we start to see this nice dip right in front of the jowl. So unless you have something that really holds that back or you have a facelift, it's hard to get this nice jawline definition back. And third, as I mentioned, the semaglutide drugs are wonderful for weight loss. A lot of people have been able to successfully take off some weight. A lot of people just got their act back together after COVID and started getting back into their exercise and good eating programs. We've seen a lot of weight loss this year and needed something to help lift and define back after we take away some of that fat that has been filling out the face. So I have a few photographs to show you. This first one is one of our clients who I'm sorry, Sam was texting me something, or somebody's texting me that I need to know. This is one of our clients that had age-related bone loss and a little bit of loss of definition or jawline. So I think you can see my cursor on the screen here. I'm going to follow her jawline, and you can see from her ear, it sort of travels straight down to her chin. You can see just before her chin that she has some fullness in her jowl area, even though she's an extremely thin woman. And then you see that her chin had gotten just a little bit shorter. the chin, the bone on the end of the chin gets a little bit softer over time. And you can see on the right, and it looks a little bit firm right now. This was immediately after injection. So as it settles over the 4 weeks, you're going to see a little bit of softening in that area. Not that the result's going to go away. It actually looks better, but it's going to look a little bit softer. But I'm going to follow again. You see that now we go down a little bit more before we start venturing forward to the chin area, and that jowl is tightened up a bit. No, it's not perfect, because we're not going to get perfect without a surgical intervention, but you see how it's a straighter line and the chin looks more appropriate and balanced with the rest of the face. I'm going to show you the other side, and you can see there again, if you're looking at this left side, there's really no definition. We have fullness in the jowl and some little divot just in front of the jowl, as we see, and then the blended chin. And here you can see it, as I said, still pretty firm, so it's going to soften up and look even better. But we can see how the jawline goes down and then starts to lean forward. The divot's not quite as noticeable, and the chin is in better balance. And we also, if you notice, you can see a little better in this previous picture, we were able to take up some of that laxity under the chin. We call that submental laxity, that under the chin laxity, and it has picked up a little bit there. This is another client that allowed me to use her photo. Excuse me, I've been talking all day, kind of dry. And you can see here, she has a loss of definition here. You can see the jowl fullness there. And you can see how the chin doesn't look quite as supportive of the lower face. But when we look on the right-hand side, you can see she's got a little bit more definition in the jawline, a little straighter line to the chin. The jowl isn't as noticeable, and the chin is in better balance with the rest of the face. So those are both age-related loss of bone and tissue, and our Volux is going in and making that lower face look better. Now, the next one is someone who lost weight. So she has really been out eating well, lost weight, and what she noticed was that her jawline wasn't quite as firm as it's always been. She has an excellent chin. Her chin, we didn't do anything to, because her chin, she brought her chin and it looks great. But you can see the softness here. So we injected the Volux along the gonial angle here and down so that it created this nice straight line to her chin and took away that little pooch that she had there from her weight loss. We actually used a little bit of Voluma as well to lift her mid-face here, because that also helps pick up that jowl area. Now, this next person has a genetically shorter jawline. And this is what I was talking about when you see somebody whose nose is a little advanced over the chin. And there again, just like the first photo, this is immediately after injection. So it looks a little bit firmer right here. In 4 weeks, it's going to look softer, not less of a result, but it's just going to look a little bit softer in that area. So you can see in the before picture, there's really no angle. It just sort of filters straight down. She has a little pooch in the jowl area and a shorter chin. And you can see in our after picture, she has more of a defined jawline angle, or it's called a gonial angle. It slides down and she has a little bit more chin projection. And she is absolutely thrilled with that. I'm going to show you her other side, and you can see there again, she had a little bit more poochiness right over that jowl area. We also gave her, you don't see the cursor. I'm sorry, you're not seeing the cursor. But you can see in that mid-face, her cheek looks a little bit lifted. And you can see that she has more definition in the jawline and to the chin. So you can see why we are so excited with that Juvederm Volux. And people who are experiencing weight loss and aging, you start to lose some of the fat pads in the middle of the cheek here. I have a big face. I have big lips. I was genetically born that way. But I notice as I age, I am starting to lean forward. I need to fix myself a little bit here. Lean forward because my fat pad's getting just a little bit smaller. So you'll notice on people that aren't doing interventions to help, like, you know, the radio frequency microneedling and lasers and injectables and things like that, that over time, they're going to start to be a little bit flatter here, a little bit flatter in the hollow. The angle is going to get softer, They're going to develop more of a pooch right here, a hole right here, almost a thumbprint, and more of a nasolabial fold. So what we do when we're trying to restore mid and lower face, we're not trying to blow it up and make it look bigger. We're lifting the cheeks with a little bit of voluma and lifting here with a little voluma, maybe a little bit here. We don't want to look handlebar. And then we're putting our Volux along here to lift back. So we're lifting up and we're lifting back. And that's the effect that you're seeing in the photographs. Several people that have tried threads before say that they're seeing a lot better result and hold with the Volux than they did with the threads. We haven't ventured into threads yet. We haven't heard enough good feedback to try it. I'm not saying we won't, but for right now, we're really pleased with what we're getting with our injectables and tickled to hear that feedback on Volux. So voluma, those of you that have tried it know that it lasts 18 months to 2 years, typically, if we restore you enough to see that result. And that means if this is your bone and this is your cheek, and you start like this and you need a little bit more cheek, then if we only give you this much cheek, it's not going to last as long. I think that makes sense. But if we give you enough to fully restore, then it would last 18 months to 2 years. Volux, when FDA tested it, the providers in America were eager to get it out, and for FDA to say, well, it lasts for 3 years, they have to let it sit in that face for 3 years and then say, okay, it lasted 3 years and we started seeing it wear off. We went ahead, or Allergan went ahead at 1 year and said, that's good. We'll give it a 1 year indication. So we officially on label say it's going to last a year, but I wouldn't be surprised to see it lasting more like 2 years, maybe even a little longer. We're just going to have to see how that goes. I'm going to move on now and talk about our next fun goodie that we have. This one is called HydraNeedle. We have 2 different types of HydraNeedle that we're offering. One is HydraNeedle Esthetician, or Esty, as we call ourselves for short, and the other is HydraNeedle MD, and that one will be performed by the registered nurses here on staff. So it's funny, sometimes we come up with things and we are creating a new procedure to do for someone that is needing something. And it's like, oh, I see that you need this. Let me try this and see how it works. And then we talk to each other. Oh my goodness, so-and-so came in and she had this problem and I tried this and it worked really well. You might want to try that. And then, Tara has somebody come in and she tries it and she's all excited. And then she mentions it to Mary, and Mary mentions it to Kelly and Olivia and Sherry and Latrina, and it just goes on. And we all start doing something and realize, wow, this isn't on the menu. It's not official, but we're all doing it. So let's make this official so we can tell everybody about it. And so this is how this came about. I had a young woman who came in to see us. She's absolutely beautiful. And she said, I'm having issues with my skin. I'm breaking out. I'm a little bit blotchy. I don't like my pore size. I feel like I just look dull. I had all kinds of complaints, which kind of laughed at because she was young and absolutely perfectly beautiful, but I could see what she was talking about. And so we were doing some things with PRP and microneedling at that time, but she didn't really need everything that I was doing. I was doing it more like for anti-aging and lifting and rosacea and things like that. And my sweet young Sydney really didn't need all that. She just needed some PRP and maybe a little hyaluronic acid to give her some hydration. So the photograph you're looking at is Sydney before. And then this is after having 2 treatments of HydraNeedle Esty, because this is one of the ones that the estheticians offer. It doesn't have the medications in it that the registered nurses have to dose. So this is a lot like having microneedling. Whenever you're doing collagen induction therapy or microneedling, we go across the skin and we do the microneedling needles, the little has several 25 needles, and we're puncturing the skin and making lots of little holes in the skin. And then we're going to rub some of the hyaluronic acid on, maybe some of the PRP on there, and that's going to give you a nice result, but you get a lot of inflammation with that. So our clients that have active acne or they have rosacea or something like that, we can't really offer that treatment to them because they're going to be more inflamed. Some people just simply don't want that downtime. So the good thing about our HydraNeedle, whether we're using the esthetician version or the MD version, is that we don't create so much inflammation and so much downtime, particularly with the esthetician version. It's sort of like a lunchtime treatment. You can come in, get it done, go back to work, and you don't have the downtime. Whenever we are doing the esthetician version, we are customizing for your concerns. So everybody, we're going to use PRP for you. The PRP is where we draw some blood in a tube for you from your arm, like you go to the doctor's visit, and we put it into our centrifuge where we can do the centrifuge and spin out the red blood cells. Those are trash in this situation. We don't want those. But when we concentrate down that PRP, we're getting 6 times concentrated growth factor in that solution. So that's just like super ammo for everything. Whatever your body needs to do, it's going to make your body remember to do. So we love PRP. We're a huge PRP practice here because we can see it's using you to make you look better. So there's no risk of allergies and things like that. And that is a really nice thing that a lot of people enjoy, just going and using something more natural. So when we're customizing for you, we're going to take your PRP and, everybody needs some hyaluronic acid. We use hyaluronic acid for everybody in their microneedling or HydraNeedling, because you need that little boost of moisturizer beneath the skin. It's going to make the skin glow. Say you have a lot of sun damage, we might decide that we want to use vitamin C to brighten your skin. You have a lot of fine lines and little creases, we might put retinol in there to help resurface the surface of the skin. We might use peptides if we see that you need a little boost of tissue growth. We might do that. So your esthetician is going to work with you to customize that little vial of PRP and goodies. This is a HydraNeedle. So whenever you start to do that, we're going to bring you in the office. I make some numbing time for you. I'm the biggest wimp you're ever going to find in this practice. So if it might hurt, I'm going to do everything I can to make it not hurt. You don't have to numb. It's generally sold to the public as something you don't have to numb for. But I can tell you that when you take 25 little gold needles and you're stamping them into the skin, it feels like somebody has a hairbrush going after your face. I don't like it. So I don't mind numbing cream. I don't want to feel anything. We'll put a little numbing cream on for 20 minutes or so. Wash it off, put a little alcohol on to cleanse the skin thoroughly, make sure we've got all that numbing cream off. And then your esthetician has prepared your HydraNeedle. You're going to see it has some yellow fluid in it, and they're going to lay you down flat and they're going to stamp it into the skin. So we're going to do little stamps. Whenever we stamp, that little centerpiece will go down into the top here, and the solution is going to flow down these little etch needles into the skin. Many of you remember this as Aqua Gold and Halo. I've renamed Aqua Gold and Halo, but the esthetician version is new. It's a lower price point for those that don't need the MD version, and I'm going to tell you about the MD version next. Now, people say, how often should I do this? I'm going to go back to my young Sydney. Sydney has come in to do this treatment about once every 6 months or so since 2018. This is 2023. She's really done nothing else with this, and you could, for her skin, and you can see that she looks amazing. The blotchiness is gone. Her pores are tight. She just has a nice glow about her skin. And I can speak the truth that she really has done nothing else. She uses some great product, but she was starting to use product in the first picture, but that is all from her HydraNeedle Esty treatments. Now I'm going to move on and talk about my HydraNeedle MD. So whenever we're doing the HydraNeedle MD, we're going to draw a little bit more blood from you because we're actually going to take some of that PRP and we're going to inject it. So we inject it in places where you need a little extra help. Underneath the eyes, for instance, most everybody wants a little rejuvenation beneath the eyes. So if we take the 6 times concentrated PRP and we inject it underneath the eyes, we're going to get this nice rejuvenation process going. Oftentimes we inject it in the nasolabial folds, sometimes around the jawline, just to give you a little bit more collagen strength there. If you have brown spots, you have a couple of pimples, something going on, we can inject around that to help the healing process, and use quite a bit of that PRP for injections. The eyes are a miracle, and I'm going to talk a little bit more about that in a second. But then we're also going to take this little HydraNeedle, just like the estheticians did, but when we're doing the MD version, I'm going to add Botox to your PRP, and we're going to also add some Juvederm to your PRP to make it a little bit more effective for tightening pores, giving you just a little bit of lift, healing eczema type situations, skin irritations, rosacea, things like that. The Botox is nice to tighten down those little capillaries, creating that redness and take away a lot of redness. This is so popular with people that have irritated skin, flushing, rosacea, things like that, acne. We don't want to really punch around a lot on active acne, but just sporadic acne, this is a wonderful treatment for that. And this is actually my favorite treatment. So I make sure that I get this done once every 6 months because I once had tear trough filler and did not like the way it made me look or feel. I always felt puffy under my eyes. If you're going to do tear trough filler, you have to undertreat very slightly, or every time you're dehydrated, you eat a salty chip, you drink a margarita, you're going to get, it's a hydrophilic product, means it loves water. So you're going to get some water around that area. And I always looked swollen and bloated. I hated the way I looked. So I choose to rejuvenate my eye area with PRP, and I am so thrilled with that result. So I make sure that I do it once every 6 months. I could honestly do it more, both with the esthetician and the MD version. If you wanted to be more aggressive with it, you could do like 3 sessions once a month, and then go on a maintenance where you're doing it every 4 to 6 months or so, and just keeping up your results. But it is a wonderful thing to do a little bit more aggressively if you're wanting to see better results. So same thing, we would bring you in, give you a little numbing cream for 20 minutes or so, cleanse the skin, bring you into the treatment room. We'll already have things set up for you. The MD version would be done by your nurse injector. So that would be Mary and I in both Snellville and Hamilton Mill. We'll inject a little of the PRP in the places you need it the most. Next, we'll pick up our HydraNeedler that has the Volux Juvederm and the PRP. And again, we're just going to stamp it into the skin. Those of you that have done this before may remember this as the Halo treatment. I changed that because it was very confusing. I named my Halo, and then a Halo laser came out. So people were going home and reading that their face was going to be chewed up for 6 weeks and saying, oh my God, Chrissy, I don't want that. So I'm changing the name going forward, and this is called HydraNeedle MD. That's what we're going to call it. It's going to be easier around here. So we will stamp the skin with that. And it's a very popular favorite with a lot of our clients, formerly known as Halo or Vampire Facial, Vampire Facelift. All of those things have changed. We've changed the protocols, and now it's HydraNeedle Esthetician or HydraNeedle Esty and HydraNeedle MD. So those are favorites. Now, I mentioned the PRP under the eyes, and I first want to show you one of my clients that enjoys this, that didn't mind if I shared her picture. And so if you take a look, you'll see that in the picture on the after side, the right-hand side, she just looks smoother. She has a little bit of glow about her skin. Her under eye creases are softer. Her lips even look a little bigger, which we did nothing to her lips. We didn't do Botox. It's just that when you do the Botox and the Juvederm in the HydraNeedle, you get just a little bit of lift. When you inject PRP under the eyes and around the mouth, you get just a little bit more clearing of the skin and a little more hydration. So you can see how she just looks a little bit fresher and a little bit smoother and lifted in that right-hand picture. So that's the effects of the HydraNeedle MD. Now, I want to move on because, as I mentioned, whenever we are doing this, we put the PRP under the eyes, and some people enjoy that so much, they either come back after their HydraNeedle MD to do additional PRP under the eyes, and we have that priced differently. Or maybe they just say, I don't really care about everything. I don't want my eyes to look like this. And so we don't do HydraNeedle MD. We just do a treatment called PRP eyes. So those treatments we typically recommend, you can do 1, see how it goes. We typically recommend that you do 3 if you are concerned. Say an unstable connection, and I'm just making sure that you guys can see me there. So if we are concerned about the under eye area, we can just do PRP under the eyes. So I'm going to show you this client. She didn't want to do filler under her eyes. She wanted to try the PRP eyes. So this is after 2 treatments of PRP eyes. And you can see that she almost looks like she's had an injectable filler under her eyes. It's a little bit filled in. But if she goes out and decides to have margarita night, she's not going to feel puffy. She's not going to look like she has a finger under the skin under her eye. You may have seen that before. Sometimes when people get tear trough filler, if you don't undertreat, like we always try to undertreat and just explain this to our clients, but sometimes people want that Instagram ready look, and sometimes providers will fill a lot of Volbella, Restylane, something like that under the eye, an injectable filler. And when it heals, and that product starts to take on that fluid as it does, it'll look almost like they've got a little roll under their eye. And that is actually the filler with the water sitting in it. So sometimes we break that in. Somebody will find us and say, can you help me with this? Because it didn't turn out like I wanted. Not our clients. Not to say that we never have something that we correct, but we've just been here 21 years. So we know, don't overfill a teardrop. And even sometimes like me, of course it wasn't overfilled because it's me, but it was just a little too puffy for me under there. So this is a wonderful alternative. This is the same client when she's looking up, and you can see she still has that little bit of trough, but it looks much softer after the PRP eyes, and she's continuing to do a few more treatments just to try to get a little bit more clearing under there. This also works nicely for pigment. Sometimes our darker skin clients will have more pigment around the eyes. That's sometimes a genetic predisposition. This client is thrilled. I believe in this picture, she has had 2 of her treatments done, and you can see how she has a lightening of the darker areas around the lower lid of the eye, and made her skin look very pretty lady. And then I'm going to show you my next photograph is of someone who has some wrinkling under the eyes, getting those little crinkles that we don't like over time. So she actually had the HydraNeedle MD before and after. So you can see her skin looks better. Her face looks, I didn't leave her entire face in this shot, but you can see that her cheeks are a little bit lifted if you look there. But you can see this is before and after. So if you really look under her eyes, you see how those creases look a little bit softer. Now, this is before and after 3 treatments. So you can see she has significant clearing of those little fine lines and creases under the eye there. And she is absolutely thrilled. And I am too. And it made me say, I'm going to go back and go ahead and get my next one done. So that is the PRP eye and the HydraNeedle MD. As we're talking about PRP, I just want to talk a little bit about PRP hair, because just like the weight loss and the COVID weight gain, a lot of people lost hair through COVID. We see a lot of aging related hair loss. You know, most everybody at a point starts getting a little thinner around this point, male and female, up in here a lot for our gentleman friends. And we have been doing a lot of PRP hair. We love PRP hair. I mean, you can still do all the things, the minoxidil, the drugs that are orally prescribed. We don't do any of that. We let the dermatologist handle that, but we do a lot of PRP hair and see some phenomenal results. And we do have a nice wow special for you. So this is for people that have had genetically thin hair. Sometimes we have young people that come in that say, my hair has always been so fine. And they do the PRP hair. Sometimes for them, they don't even have to maintain it. It's like the hair remembers, oh yeah, this is what I'm supposed to do. And they have this nice healthy hair. If you're somebody that's dealing with age-related hair loss, we recommend that you do our series of 4, 1 a month for 4, and then you come back every 6 months. PRP is going to last for 12 months, but it's going to peak at 3 months. So if we retreat at 6, we're keeping that strong PRP going so that you don't suffer hair loss. Sometimes with our older clients or someone who has PRP that's not quite as rich for some reason, we will recommend that they come back in at 3 and 4 months just to keep the process going. I'm going to show you some of our graduates of our PRP hair. This is a woman who just noticed that her part was getting wider and that she was just getting thinner on top. So she came in to visit us, and the picture on the right is after her 4 treatments. So it's 5 weeks after her 4th treatment. She's starting to see this significant reduction in hair loss. And so what we find with PRP hair is that you first notice less shedding. So, you know, if you're looking in the shower and you're seeing all this hair in the sink and in the drain, it's so stressful. And that's one of the first things people say is, I notice that my hair isn't shedding quite as much. The second thing we notice is that the hair on the entire head gets healthier. So where hair might be brittle and dull, you start to notice that it has a luster, because we may be injecting in this area, but that PRP is traveling all over the scalp and affecting all the hair follicles, and the hair starts to look shinier and healthier. And lastly, we start noticing new hair growth. And that's so exciting to see those little baby hairs come in, and over the course of time, they get thicker and longer and stronger. And they're not going to pop out and be like wow hair in the beginning. But as those start coming in, you start noticing the hair have a thicker appearance because you have all those little baby hairs pushing up and making a thicker ground, like ground cover there. I'm going to show you a few more pictures. This is another client that actually has the lichens. You know, there is a autoimmune disorder that can make the hair thin and make sort of a plaque on the scalp. And you can see right around that hairline how much thicker that hair is starting to grow in. She stopped receding as she was doing since her diagnosis, and you can see that her overall hair has gotten much thicker. And so this is at before and then after her 4th treatment, several weeks later. So it's over about 5 months. Here's a gentleman who was thinning in the front there, and you can see that he really started seeing some significant growth in doing the PRP. Sometimes people, these photographs that I have shown you and that I will show you are before and after the series of 4, but we do have several people that are doing so well after their series of 4 that they decide to do another series, and we do reduce that, or if you've bought on a special, give you some special pricing so that you can do that second round of treatment. This is a young woman who came in, and she was so upset. She's a younger woman and had started feeling so much loss around the front of the hairline. She likes to wear her hair parted down the middle, and she was having a really hard time with that. She couldn't wear it parted anymore, and she's so excited that she has started parting in the middle again. This is before and after her series of 4, and she is looking great. We're really excited for her. This is another client. This is actually one of our former employees. I'm going to out her because she doesn't mind. This is Peggy. I saw Peggy today, and I miss her so much. If you're out there, Pegster, we miss you. She always told me I have cat hair. And so when we did PRP hair, she came in and got that done. And you can see on the right that she had significant thickening of her pre-existing thin hair. She wasn't really getting a whole lot thinner that I remember. She just always had thin hair. And this is giving her a better texture. And I like this next picture because people will say, oh, well, it doesn't work whenever you're a certain age. Well, this sweet little client was in her 80s and suffering from balding, and her hairdresser told her about me. And so she came in, and this is after her series of 4. Yes, she still has thin hair, but she is a whole lot thicker than she was. And we are thrilled for her that she is not able to see her scalp when she looks in the mirror anymore. She has significant coverage. And I love this last photo. So this is a young man that was coming in. He was starting to notice thinning at the crown. And you can see on that left-hand side, there was he had some significant thinning, but if you look down in there, you could still see active follicles. And so the last time he was here, I took a picture and I said, I want you to see all your new friends on your head, because it's so hard. You can't see your crown. You just know that you see more scalp than you want to in pictures and the surveillance cameras that you walk under at the grocery store, things like that. So you can see he has so much new hair coverage there. And that's going to continue to grow in and get thicker and stronger. So really, really excited to see that. So that is PRP hair, and lots of good PRP going on here. We love our PRP. Now, next, I want to tell you about some things that are going on with an existing treatment that you may have already had. Vivacé came out in COVID during 2020, and we have loved Vivacé. We've seen lots of wonderful results with it. In case you don't know Vivacé, it is a microneedling radio frequency device. So it is a machine. I will show you the machine here that looks like this. It has a screen that we're able to plug in the parameters that we want to use for you. And on the right-hand side, you can kind of see it's in the holder, but it's a handpiece that we attach a disposable tip to. And it has gold needles that we can set to go into the skin. And they deliver a little blast of radio frequency, and that will stimulate collagen. And as I said, we have loved this treatment. It has been a game changer for a lot of people. But we started reading the research that was coming out about Vivacé and some new protocols that were coming out and ways that we could change the way that we were using it to create less pain for you, but yet more significant lifting and tightening. So we called a consultant to come in and work with us, and we revamped our protocols. Olivia, the lead esthetician in Snellville, Kelly, the lead esthetician in Hamilton Mill, worked with the consultant. And then we had time to sit down with the rest of our esthetician staff, and we've created new protocols that are amazing. So what we are seeing now is that we were able to increase our energy without creating more discomfort. So we're able to give you a better, more thorough treatment, but it's not hurting more. And that, for the big pain weenie here is the biggest thing. We have added an additional treatment that will give you more superficial tightening. And so with that, what I mean is to tighten the surface of the skin. The Vivacé is working deep in the skin. And so that's why we recommend that you do this if we're wanting to see your skin lift and tighten. We want to do that deeper tightening. But we also have now added something that's going to give us more tightening on that very surface to lift and tighten the skin, diminish the pores, help with those little fine lines and creases. Some of you guys have those little etched fine lines and creases, and that is something that this new part of the Vivacé is real successful in helping us with. We also are now turning the energy off and able to use the machine to drive that PRP in. So when we're using PRP with Vivacé, we are the PRP people, we do the Vivacé, which is creating these little microchannels in the skin. And then after we finish the treatment, we take your PRP and we rub it on the surface like lotion. And that PRP is going to go into those little holes that we made and create more collagen stimulation and help with the healing process. You heal much more quickly when we use the PRP. Well, now we're using those little needles to drive that PRP deeper in the skin. So it's not just sitting on the surface and going in the little holes. We're actually turning the energy off. You're numb. And we're just driving that PRP in deeper. So we are thrilled with the new way that we're doing Vivacé. Had excellent feedback from our clients. So even if you've done Vivacé in the past, you weren't real thrilled with the results for some reason, this might be something that would help you. We are very excited about it. So talk with us about that. And if you've never done Vivacé, you need to know about it. I put my photographs in here for you. I mean, you might as well out yourself when you're doing this. So this is me. You can see on the left, I look like I've been drinking vodka for 6 weeks. I look like my nose is sitting lower. My lips look flat and wide. I have big lips. I've had big lips my whole life. And as I've aged, I don't want them bigger. I was bullied for big lips, but I don't like when they sit flat. And you can see on the right-hand side, it actually picked my mid-face up. It picked up my cheek and it picked up my lips. So I look more lifted in the center. And that is interesting because you guys come in and you say, I want to look like this. You really don't. Maybe a little bit, but you want to look like this because this with this down does not look good. It looks like you forgot to lift that part. And that is something that we can do with Voluma, but we love to use devices before we use filler. If we use a device, we get your skin as tight as possible. We make your body do the work of lifting and tightening and getting everything where we want to be. Then we tweak with filler because we can't make all areas look nice and tight and rejuvenated with filler, but we can go back and augment with filler after we do a device like Vivacé and make things look really nice and natural and lifted. I'm going to go back to my photograph here. Let's see, I'll show you my oblique and you can see how it even lifted. You can't see my cursor and I'm disappointed because I thought you could. So I'm going to tell you, when you're looking at these photographs, I want you to notice the lid cheek junction. When the lid and the cheek are far apart, you will look older. So what we try to do with Vivacé and what we try to do with filler is reduce the lid cheek junction to make this sit higher and make you look more youthful. So I'm going to go back to my photograph and you'll see that on the left-hand side, my cheek is sitting lower. So there's a longer distance between my eye and the top of my cheek. And it's lifted up on the right-hand side. So I have a shorter lid cheek junction and it makes my cheeks look more youthful. In that oblique picture, you can see it as well. It's just lifted a little bit. So it makes the whole face look younger. And I'll show you the other side. And you can see I still had a little bit of acne scarring on my cheeks whenever I started doing my Vivacé, and it really cleared that up. You would think as long as I've been in this industry, acne scars would be history, but I did still have some acne scars. All right. And so now I'm going to switch over. Olivia is actually here with me live tonight, but we did go ahead and pre-record her part just to make it easier for you guys. And so Olivia is our lead esthetician in the Snellville location. And I'm going to switch over and let her tell you about a couple of new things that are going on here.
Hi guys, my name is Olivia and I'm one of the estheticians here at our Snellville location, and I just wanted to remind you that we now have Cool Peel in Snellville too, so we now have the Cool Peel in both locations for you guys. For maximum results, we like to do our combination treatment, which includes Vivace RF microneedling and the Cool Peel. So Vivace is advanced microneedling, so we are producing collagen with it, and the Vivace has RF, which is radio frequency for the skin tightening. So we are tightening up the skin, producing that collagen, getting that nice plump and glow. And then the Cool Peel is the CO2 laser that we do on top of the Vivace, which is pretty much going to be giving you that glass-like skin, helping with the pores, any sun damage, discoloration. If you do have any textural problems like scarring, anything like that, it'll pretty much glass over the skin for you. So once we finish the Vivace and then do the Cool Peel on top, we finish it off with PRP. So we draw your blood, take the plasma, and then we just gently rub on the PRP, which is pretty much just going to calm down the skin, help produce that extra collagen, calm down any irritation that you might feel, and it just finishes off the treatment. So we recommend doing 3 of these treatments. We space them apart every 5 weeks, and then you can go on to a maintenance just depending on your skin. So it could be once a year or twice a year, all depending on you.
Okay. And I failed to mention with Vivace, we typically do 3 in a series. We do 1 a month for 3. We ask you to come back and do 1 every 6 months. And as Olivia said, when you top this with the Cool Peel laser, it's glass-like skin. It is the dynamic duo, and it's known as that in the industry. It is wonderful. And we have another new baby here, so I'm going to switch over and play one more time. I'm going to play Olivia.
Hi guys, so if you recently haven't heard, we just brought on a new at-home treatment. So as most of you guys are familiar with, our LED light that we put you under after hydrofacials, diamond glows, any treatments like that. So this is an at-home LED light, so this will help with any skin irritation. If you have a sunburn, if you have acne, any fine lines and wrinkles, it helps produce that collagen for you. This light is safe. It is medical grade, so it is a medical grade LED healing light. So if you do have internal pain, like psoriasis, eczema, anything like that, joint pain, this light does help with that. And it is movable, so you can do it under your face, you can do it on your arm, your back, anywhere where there's inflammation or irritation, this light can get transformed to that area. So the Soluma is very easy to use at home. So you just have your little control panel. So you just turn it on and then you select what you want to be targeting. And then I like to turn the pulse off so it's not like a disco ball in my face. And then I just turn it on and then the light comes on, as you can see underneath.
Okay. And another thing is if you have hair loss, the Soluma is actually wonderful for helping maintain your hair and helping stimulate those follicles to hopefully grow a little more hair. I have a Soluma at home. I love my Soluma, my pustular rosacea. It helps. I use it a couple of times a week because even though I own the joint, I can't get in to get treatments done sometimes. It really helps keep fine lines and wrinkles at bay and keep my skin looking fresh. We actually have one here. Whoops. And I just made the little side pieces fall off, but this is the size of the Soluma. So you guys that come in to see us here, you'll recognize this is the same brand as our large one that you get under in our LED room. Whenever you find cheap versions online, the reason they're cheap is because they don't have this number of diodes. That's where it becomes a more expensive product. And a more medical grade product is that you have so many diodes that are going to shine into the skin. When you have just a few diodes, you're basically laying beside your clock radio. All right, I am going to invite Kelly to join me here. I'm going to bring you on stage, Kelly. I hope you're ready. There she is. Kelly's going to
tell I'll ever be.
Some things that are going on here too. So I'm going to give it over to Kelly for a minute.
All right. Hi, everyone. I have, I wish I could see your faces. Instead, you just get to look at mine. Sorry for you. I have the new product portion of the webinar tonight, and I'm really excited to talk to you about those. And I'll do it quickly so we don't keep you too long. But first, I wanted to touch base on the Deka treatment that was mentioned earlier. The Deka is actually a CO2 laser, just like our Cool Peel, on steroids. So the Deka treatment is going to go deeper and the energy is going to be stronger. If you've ever had a Cool Peel, I would say it's probably going to be about 5 times as as aggressive as a cool peel can be. So the candidates for this treatment are going to be, coarse lines, those kind of bark coating, vertical lip lines, really stubborn hyperpigmentation. If you really don't want to go through a series of 3 or more cool peel and you just want to do one Deka treatment, be advised that there is going to be a little bit of extended downtime with this treatment because of how advanced and how aggressive it can be. But that would be the treatment for you. So it's more of a one and done versus taking it down and breaking it into smaller treatments like the cool peel. So because of this, it's also not suitable for all skin types. So we would love to have a consultation with you just to make sure that it's the right treatment for you, or if maybe we can make the cool peel work for you instead. Now to get onto the products. So the first products are going to be the Even and Correct line that SkinMedica launched earlier this year. So this is actually 3 different products that can be used separately or together. It just depends on what you're trying to treat. So all of these products are going to contain a patented LTN complex, which SkinMedica has thoroughly researched. That's going to stand for L is lotus sprout extract, T is tranexamic acid, and N is niacinamide. And not to get too sciencey, but the tranexamic acid is kind of really the lotus sprout extract is going to work to break down melanosomes in the skin. And again, I'm going to try not to get too sciencey, but the combination of these ingredients in these products in clinical trials outperformed hydroquinone, which is a huge deal. So hydroquinone is still kind of top of the line when it comes to treating stubborn melasma or hyperpigmentation, but it does have its limitations, being that you can't use it all year round. It is going to make your skin more sun sensitive. You can't use it when you're pregnant or nursing. So these products are going to be something that you can use all year round and get the same or better results as hydroquinone. So briefly, I'll just talk about each one. The first are the Even and Correct pads. These are like little toning pads, essentially. They're exfoliating. They contain 10% glycolic acid. So you're going to sweep these over the face on clean skin immediately after cleansing. It's going to be great to, of course, they have all the brightening ingredients too, but the glycolic is great for oily and acne-prone skin as well. So as well as anti-aging. So really the pads would be suitable for multiple skin concerns. Their staple product is going to be the Even and Correct serum. This is to be used twice a day. If you are using TNS, it's going to be after the TNS Advanced Plus. But this is going to be the main product that outperformed the hydroquinone. And lastly, we have the spot treatment, the dark spot treatment cream. This is going to go directly over the areas of stubborn hyperpigmentation. If you have really localized sunspots or an area of melasma that you're really trying to target, of course, you would benefit from using the other 2 products first, but then you're going to layer the spot treatment over top to really bring it home. This does contain retinol, so it's a nighttime product only, and you wouldn't be able to use it if you're pregnant or nursing, but it is really effective, and you can see results in as little as 2 weeks. Okay, on to our new babies at About Face. So these are both products that are joining our About Face Skincare 180 line. The first is going to be the Eye Amazing Eye Cream. And this is Chrissy's favorite. So if you have any questions about this or really, want someone to sell it to you, she's the one, because she is head over heels for this product. So this is a very thick, luxurious eye cream. If you've tried all the eye creams out there and just haven't found the one, I encourage you to give this a go. It is packed with peptides and antioxidants, so it's going to firm and hydrate all around the eye area, and it feels just really feels really velvety and smooth. So this is going to retail for $78. Lastly, when it comes to our new products, is going to be the Correct and Protect Mineral Sunscreen. So this is going to be a mineral sunscreen, meaning it is zinc. Actually, it could be zinc or titanium based, but it's just zinc based. It the reason that it has correct in the name is because of all the extra ingredients that are in here. So it has medical grade silicone and some proteolytic enzymes, and those are going to treat the skin while it's applied. So the silicone is going to help to diminish scars and heal scarring, as well as compromised skin or acne marks. And the enzymes that are in here are going to help to fade hyperpigmentation and enhance the skin tone and texture. So if you are fans of the IntelliShade, which has a lot of extra benefits to it other than it being an amazing sunscreen, then you're really going to love this one. This is it is non-tinted, so while the IntelliShade is tinted, it also has a very velvety texture to it. So it's great to use on its own or to layer underneath your makeup, kind of like a primer. So we love this one, and it retails for $63.50. Lastly, bring it home with the Latisse special. So if you follow us on social media, you have probably already heard, because we're really just trying to spread the word about the $30 coupon that Allie has offered. So if you are a member of Allie, go ahead and claim the $30 coupon. Once you've claimed the coupon, you have 90 days to redeem it. I encourage you to do that a little bit sooner, because then you can take advantage of the 25% off on top of the $30 discount. So if you want to grow your lashes or make them longer, a little bit thicker, then this is a great product for you to try. It's the 5 milliliter. And I believe that's it from me. So thank you for listening. I hope to see you guys soon.
Hi, I'm Caitlin. I'm one of the estheticians at the Hamilton Mill location, and today I'll be talking to you about Wow Package number 1. Package includes 3 Vivacé, 3 Cool Peel, and 3 PRP. If you're struggling with any kind of signs of aging like elasticity, any fine lines and wrinkles, and you're just wanting a more youthful appearance to your skin, this package is perfect for that. This package is a really great deal. It is 54% off, which brings it down to $2,995.
Hi, my name is LaTrinda, and I am an esthetician at the Snellville location. I'm here to talk to you about our Wow Package number 2, which will consist of a Diamond Glow, 3 HydraNeedles, and you'll receive this Skin Medica Essential Brightening Box. The benefits to this package is it helps with dulled, sun-damaged skin. You will do the Diamond Glow first, which helps with extractions as well as exfoliation. You may do the HydraNeedles once per month for 3 months, or you may extend it throughout the course of the year, every 3 to 6 months.
Hi, I'm Chrissy Thomas. I'm the owner of About Face Skincare, and I work out of Hamilton Mill and the Snellville location. I'm going to tell you about Wow Special number 3. In Wow Special number 3, we are using our HydraNeedle to make a combination of PRP, Botox, and Juvederm. And we have 2 of those. So the PRP will stimulate collagen in the skin. The Botox will give you a little bit of pore tightening and decrease any redness. And the Juvederm is like putting your moisturizer inside your skin. So it's a wonderful way to get just a little glow, a little bit of tightening, one of my absolute favorite treatments. In the HydraNeedle MD, we're also taking a little of your PRP and injecting it for you underneath the eyes and the nasolabial folds, any areas that you're having some concerns, because it will actually stimulate collagen growth there. In that package, we are also doing 50 units of Botox, which is wonderful, as we know, frown lines, forehead lines, crow's feet. We can give you a little neck lift, lots of things we can do with that Botox. And we're also including one of our Skin Medica brightening boxes that has some nice large size samples of the Ahabaha cream, the Instant Bright Eye Cream, and some of their little patches. Great special for you. It's 2 of the HydraNeedle MDs, 50 units of Botox, and the brightening box, and it is all for $1,880. That's a 31% discount.
Hey guys, my name is Barry Fuentes, and I'm an esthetician at About Face in Hamilton Mill. I'm here to talk to you guys today about Wow Package number 4. Now this is for brightening, lightening, hyperpigmentation, age spots, also no downtime with this treatment. This package includes 2 chemical peels, 3 Diamond Glow treatments, and our new Even and Correct system from Skin Medica. The Diamond Glow treatment will rehydrate, brighten, and lighten the skin. The chemical peels will help stimulate collagen production and lighten pigmentation. Even and Correct system is our medical grade skincare line that you'll continue to use at home that will continue to promote healthier, lighter, brighter skin. You can get this package today for 31% off at $8.95.
Hey guys, this is Carla. I'm the cool sculpting provider here at About Face Skincare at both of our locations, Hamilton Mill and Snellville. I wanted to tell you a little bit about our number 5 WOW package, which includes 8 cycles of cool sculpting, 1 cool peel of the face and neck, 1 180 skin polish, and 1 180 firming body repair. This is a great deal. Cool sculpting, of course, is a treatment for unwanted fat on areas of your body. No downtime with that treatment. And cool peel is a treatment that our estheticians do. It helps with sun damage, pore size, fine lines and wrinkles. It's an awesome service. And of course, 2 of our own About Face skincare line products. So it's a great deal. $2,999. Total retail value is $6,979. So guys, this is a great package and I hope you guys take advantage of it. And
hi everyone, my name is Aline and then I work on Snellville location. Today I'm talking about WOW Package 6. It's help for lifting, tightening, and no dull time, and so relaxing. It's supposed to be 12 microcurrent, 12 contour, and 4 diamond glows. No downtime, no pain, and so relaxing. It's help for firm and lifting your face. I hope to see you pretty soon in August. Have a good day.
Hi, it's Chrissy again, owner of About Face Skincare, and I wanted to tell you about number 7 WOW Special. So for number 7 WOW Special, we're giving away 2 Voluma, which we typically would use to lift you here, and 2 Volux, which is our newer injectable filler, a little bit stouter than the Voluma. It's great to lift and define the jawline. So the 2 syringes of Volux here, 2 syringes of Voluma here, and it is like you get a little liquid facelift. It's an awesome, awesome way to get some mid-face restoration. We have those 4. Typically the value of those would be $3,770. We're giving you a 34% discount. It is $24.95.
Hi, I'm Mary, Jackson Nurse Injector at About Face Skincare. I work in both locations. I want to talk about package number 8. It comes with 50 units of Botox, which Botox helps to smooth out all the fine lines, wrinkles around our forehead, our frown lines, our crow's feet. And then it also comes with a syringe of Juvederm, which Juvederm is used to restore our lips or to enhance our lips. You could also get rid of those pesky little smoker's lines. And when you purchase this package, you also get a Diamond Glow, which is an exfoliating facial done with a diamond tip to help smooth and hydrate your skin.
Hi everyone, I'm Tara Noblet. I am one of the nurse injectors at About Face Skincare and I work at our Hamilton Mill location. And I'm going to talk to you today about our WOW package number 9, PRP Hair Restoration. This is actually a series of 4 treatments. So who is this a good treatment for? If you have naturally thin hair, or if you're starting to see thinning due to age. We've seen some hair loss after COVID. Stress can cause hair loss. Sometimes anesthesia can cause hair loss. So all of these things would bring you to see us to get this treatment. You can purchase this as a series or as your maintenance package. Hope to see you soon.
Hi guys, my name is Olivia and I'm one of the estheticians here at our Snellville location and I will be going over package number 10. So package number 10 is a Skin Medica Brightening Bootcamp, which includes 3 Diamond Glows, 3 Dermaplanes, 3 Skin Medica chemical peels, and 3 LEDs. And you get 2 full-size products from Skin Medica, which is the Even and Correct Serum, one of my favorites, and then the Even and Correct pads. This package is best for someone with sun damage, hyperpigmentation, melasma, any hair on the face, any dead skin buildup over summer. There's no downtime with this treatment, which is nice, so you can go out afterwards. We do the treatments every 5 weeks. We space them apart, and then at each visit, you will be doing all 3 services.
Hi guys, I'm Kelly. I'm the lead esthetician in Hamilton Mill, and I'm going to talk to you today about WOW package number 11. This is the ultimate product bundle. It's going to include our favorite products across all the brands we carry at About Face. It is targeted for anti-aging and includes our favorite TNS Advanced Plus, but for the skincare junkie and all of us, it is great for all skin types. This carefully curated bundle is a steal at $5.99, and you are going to save over $300. Because we have selected these products at such a great price, there are no substitutions on our product bundles. If you have any questions, you know where to find us.
I'm Sherry Dursey. I'm an esthetician at the Snellville location, and today I'm going to talk about package number 12. The package includes 180 Fortified Cleanser, 180 Sea Miracle. It's a 20% vitamin C serum, 180 Line Defying Eye Gel. It's a really nice eye gel. You can use it for lots of other things. Sometimes in the winter, I even just put a pump in my body moisturizer. Age Prevention Moisturizer. It's a nice light moisturizer. So if you get breakouts and you are oily, this would be a great moisturizer.
And we will see you when you're ready for us again. Take care. Bye-bye.
Bye.